Hi, I'm Dr. Nadeem, Consultant Emergency Physician at Indira Gandhi Cooperative Hospital and Academic Director for MRCEM under StudyMEDIC. So we had started this MRCEM Academy in Indira Gandhi Cooperative Hospital for almost 6 months plus now, and these are our first batch, and we are right now having almost 6 students running in our batch, and it's completely a new kind of thing in our hospital where even emergency department was not there in our hospital for until last year, and it started almost 1 year back that the hospital needed an emergency department to sustain a proper quality for patients for any super specialty that's running in the hospital. So when emergency department started, I took the charge for starting this Royal College Emergency Medicine program because I myself did MRCEM, and the people out there clearly know that the situation for the NEET graduates is uncertain, and along with that we have this PLAB. I am also a candidate for PLAB. I did my PLAB in 2019 and I couldn't go for PLAB 2 because of the COVID outbreak, and I got stuck here. But I really wanted to pursue my career in emergency medicine, so thankfully I was guided for MRCEM training in Kerala, and I could do it. And right now, since I got it done, I wanted my fellow juniors also to get benefit of this program and fasten or speed up their career. Instead of getting stuck in a zone, I wanted them to excel as early as possible without having any dilemma to choose on which part they want to start it. So right now we have the candidates who are passionate about emergency medicine, and we onboarded them, and we have started this program in a way that it is structured completely, and with the help of StudyMEDIC we are providing them online classes, and StudyMEDIC takes care of their mentorship and all the online classes, and we emergency physicians in Indira Gandhi Cooperative Hospital, me, Megha, Dr. Smriti and Dr. Jinsi, we 4 of them are right now leading this department and helping them to teach the MRCEM or to learn emergency medicine as a subject. We teach them the Bible of emergency medicine from our ER department on the floor, clearing their doubts and making them as a competent emergency physician on the floor. So I take pride to be an academy or a lead in an academy run in Indira Gandhi Cooperative Hospital, which did MRCEM first part in 6 months and with 100% of success. So I really want to congratulate my fellow juniors who have right now cleared this program in 6 months, and it is kind of an express program. I mean, you take any part of India, I think apart from all the academy, we are the first academy to go through this success program or to have this express program in such a structured manner and complete in just 6 months. So right now we are here. We have our MRCEM Part A success students right now, and we are going ahead for Part B soon in the coming September batch. We are into a system where we want them to learn. At the same time, we want our department to be empowered with better quality residents. So it helps the hospital. It makes the consultant to sleep properly in the middle of the night because they don't want to. They are relying the entire department on us. So in a nutshell, it is completely empowering our hospital quality and care, patient care, and all these residents are right now budding on their own aspects. We are empowering their skills. They are having their own peripheral postings and all the super specialty posting, and they're right now in a competent manner for this hospital to go ahead with. So I think I can hand over the mic to the rest of our candidates so that they can talk about how their experience was and what they would like to, why they chose Indira Gandhi Cooperative Hospital, why they chose MRCEM, and how is it going for them and how our course is helping them. So I think you guys can talk about that.
Hello, my name is Dr. John B. Mattapallan. I'm one of the MRCEM resident practicing here at Indira Gandhi Hospital, Kadavantara. So when I tell about my MRCEM pathway, it started where my PLAB route ended. So I did my PLAB and I got my GMC registration 2 years back with the hope that I'll be soon obtaining a job here at UK itself, because that was my entire plan, which I initiated soon after my internship. But at a point, for improving my skills, I joined here at Indira Gandhi, and during that time MRCEM was not even initiated here. But soon on the way, I still have this admiration for working in UK, but the thing is that the level is getting saturated. and you are not getting much calls to UK. So from there, but you have to equally improve your skill, and also you have to attain a higher level. That is, upgradation is required in your field. So that's why I gave a big thought about that, and I discussed with my consultant, Dr. Nadeem, about regarding that. So what should I do? Because there was a stage where where I couldn't move forward. I couldn't decide a thing, and this MRCEM thing came, where Dr. Nadeem explained about its great part which can help you in future. And also, as most of us must be knowing that in earlier times, MRCEM was trained over a time of 3 years. But the one of the good thing which that attracted me towards the StudyMEDIC MRCEM is that they are training you within 2 years with their app, and also they are giving us a ground practice here. That is the other good thing which attracted me here. So they are allocating you to different postings, and when you are an emergency physician, you can't just deal just small cases like fever or just cough. What I believe is that is not what you just should be dealing. You should be dealing something that must be life-saving, and that gives me much more satisfaction. So with that point, with this ground practice, I understood that you are involved in much more bigger procedures such as intubation, central line, and also you are able to read the bigger investigation part and analyze the report and act accordingly. So at a point I understood that this MRCEM is the right thing for me. It will guide me, because right now this is my second year I'm working in emergency medicine, not just here in Indira Gandhi. Before, I was working 1 year in MRCEM Kolanjeri. So from that point itself, I understood that my major interest is towards emergency medicine. So I'm glad that I joined this program, and I'm also very thankful to our mentors, Dr. Nadeem, Dr. Meka, Dr. Jinsi, Dr. Smriti, who have given every support even during our exam time. And also this, I can definitely tell that this can be inspiration to the coming candidates. And right now we are having 6 candidates who are training, 3 in our batch, and 3 are doing the course, which are our junior batch. And I am also able to know that there's a lot of intake calls are coming. So I believe that is also part success of this program.
Hi, myself Dr. Gregory. I'm second year MRCEM resident at Indira Gandhi Hospital, Kadavandara. When it comes to emergency medicine, it's all about passion I followed. Choosing emergency medicine in Indira Gandhi is because of Dr. Nadeem, who I contacted before joining here. He promised me excellence in academics and hands-on experience. Emergency medicine was taken by me because of passion. I had passion for emergency medicine from the first year onwards during my MBBS. I finished my MBBS when I was like 2023, followed by which I did 1 year NEET PG coaching in India, which actually was a little bit stressful because of uncertainty in exam dates and the amount of stress it had. So due to uncertain exam dates, it was causing me a lot of mental pressure, and decided to choose RCM Academy. And RCM provides us the exact dates where the exams takes place, which helps us to calculate our studies, and same time we can also work along with it. StudyMEDIC, I chose StudyMEDIC because of the brand Srishna sir, and all those who are in part of emergency medicine knows Srishna sir, and the mentorship he gives helps us to succeed in our goals in emergency medicine. And in Indira Gandhi, I chose Indira Gandhi because of Dr. Nadeem, whom I contacted like 2 months before joining here. He promised me the excellence in academy, and along with that, he also promised me 100% hands-on training. By the end of 2 years, he promised me that I'll be a good ER physician. And after joining here, like it's been 10 months, I started emergency medicine in Indira Gandhi. So far, he have trained me well, and he have like promised, like he have guided me like as if he promised me, and I was able to do many procedures in emergency, and looking forward to finish my course in next 2 years and finish all 3 parts of exam, MRCEM exams.
So I think across our hospitals, I mean the student scenario right now, of course MBBS is getting saturated. A lot of students are coming out past MBBS. There was only 2 pathways for us. Either you go for NEET and go for the normal pathway where you get an MD seat, a DNB seat, and you go in that pathway. Mostly for graduates who are planning to stay in India. And for people who want to go abroad, there was the pathway which was more accessible, or the pathway which was possible for us was definitely the PLAB pathway. So I was a part of PLAB pathway, you were part of NEET pathway, and you tried PLAB too as well. So fortunately or unfortunately, just because of the COVID issue, I could put a stop for my PLAB pathway after PLAB 1, and I could join to MRCEM right away. I didn't waste much of time out there, and right now I do have option to get GMC registration. But for you guys are the exact replica of what students are facing right now. You had this facing of uncertainty with the NEET, and you had the problem of the PLAB. And PLAB, of course, UK completely, NHS is not getting that much entry as if they had in Brexit issue happened. Until 2018, 2019 it was trending, and we all went for PLAB because of that. And NEET at the same time, if you want at some point of time you want to move abroad or go to GCC countries, it is some disadvantage that even if you have an MD from even from AIMS, if you have an MD, you still have to get a UK degree or an national degree to get placed. So I think that's something we are right now looking at. And even right now for you, Gregory, probably you will be able to say how, you were into that NEET pathway and you are still not away from it. So how do you think as you go ahead, even if you want to continue NEET, how this program help you, and how efficiently are you able to get your career on the go instead of getting stuck in some place?
NEET PG was very difficult because of the uncertainty which caused me, because the exams were preponed and postponed. Even exams were cancelled the day before exam, which caused a lot of mental pressure actually. I took 1 year break after my MBBS in 2023 just for preparing NEET. I was not paid. I was just sitting home and studying. All the pressure I was putting for a single exam. And the NEET PG was postponed without even a notice. The day before exam it was postponed, and they didn't tell us when was the exams. So I was not able to plan my career or anything based on NEET PG. But the reason I joined RCM is the same what was told. We have the exam is going to happen on a particular date. Certain date. We have that certainty. Okay, I can study for 1 year. I can work along with that. I know that the exam is going to happen next year at a particular date. So which reduced the mental pressure on me. And even right now also emergency medicine, RCM guidelines are also included in NEET exams. So even if I'm studying for part 2 exams in emergency medicine, RCM guidelines, I can even go back and write NEET exams, which I'm planning right now. Mostly after passing SBA, part B exam, I might go back and write NEET also. I'll give it a shot. Even though it's not needed, because MRCEM is equally qualified as MD emergency medicine in abroad. Since I'm planning to go to GCS countries, RCM will help me a lot. And preparation is same for NEET and RCM is comparatively same.
Your pathway is still open, and
yes.
The good thing is that you're earning, you're still working.
Yes, exactly.
You're not stuck somewhere, you're
yes.
moving. Your career is on the go.
Yes, yes.
So that's what I think. And of course, we won't say that just with an MRCEM from here, you won't be able to, an MD equivalent degree you have, but still, you're getting that access to GMC registration in UK right away.
Exactly.
You can go back to FRChem,
yes.
and you can go into that training program, you can get into ST3 or ST4, and you can continue that training program out there. And this means that for someone who's so passionate about emergency
yes.
medicine, who want to progress, they can, you can even, if you are planning for something which is way above MD, I think FRChem is the best thing.
Exactly.
And FRChem pathway is only open if you do MRCEM.
Yes.
So for you, both both pathways are open right now.
Because when I was trying so hard for NEET PG, it's actually narrowed my mindset. Because I have to get into NEET PG, I was ready to compromise any subjects. I was so passionate about emergency medicine. Then later, due to mental pressure, I decided, okay, whatever I get, I may choose. I was ready to choose even non-clinical subjects for MD. But later on, when I talked to you about MRCEM, you only guided me to choose MRCEM. So once I decided to join RCM and study MEDIC, I was able to like fulfill my passion in emergency medicine and go forward, as I said, to any other countries or finish my FRCOM training in future. So it's helped me a lot to follow my passion in emergency medicine.
So even John is another replica of the victims right now. We have even for me and for you, there are a lot of friends out there who have completed PLAB and got GMC registration, but they are stuck in a place where they are not able to move ahead with PG program just because they need to enter into a training pathway. If they want to enter into a training pathway in UK, you have to get an SHO post. Somebody has to call for an interview in UK, and you have to get into that system. Only then NHS will let you work or continue the training program. But for you, I think this program is opening that path. And for those people who don't want to waste time, I mean, right now, if you are given another chance, I don't think you will go for PLAB again. You might right away start MRCEM, and you are someone who wants to pursue your career or your post-graduation in abroad country. So I think this helps you, it helps the rest of the students who are watching this podcast to understand that you don't have to be stuck for 2-3 years just to call for an interview. You can still keep moving on with this, and even with Part A and Part B, you can still get placed but the CSR pathways are there, CCT pathways are there. So I think you might have a better insight on that. So what do you like to say about
how I came to this pathway is that during that time, PLAB was something which was on the peak level. So most of my friends who did PLAB, the next step is straight they get the job. So that gave me a hope that so after all, the one thing which I don't like about the Indian system is I feel that you are not getting paid for the effort that you have given or about the level of study we have done. So that made me to give a thought to go to UK. But there started my PLAB. So even after my PLAB 1 and PLAB 2, I thought, this will make me reach somewhere where I'm destined to. But unfortunately, that was not where I ended up. So
I think you wasted almost 2 years past GMC registration.
Not 2 years, but about maybe 1.5 years. Because
I think for complete PLAB pathway, I think you took almost total. How many years did you take?
About 1.5 years.
For PLAB, and after that, waiting for
including the language exam.
And after that, you are waiting for an interview call for almost 2 years right now. So it's almost 3.5 years investment without getting a call, and that's when I think.
So most of the people, I think the other thing which most of the people didn't understand is that the PLAB is something which will get you a PG level. No, that's not what. PLAB is just a license exam, which the sad part is even some of the doctors doesn't know. So, but that is where MRCEM excels above PLAB, I understand. That because for every doctor, I don't think even up to 90% of doctors, they just don't want to end up in MBBS. Most want to upgrade to their PG level or masters. So when we consider that part, I think this MRCEM is doing, it is making your path much more easier. And also, you are doing exactly like a PG. That is, you are seeing patient, you are getting paid, you are dealing with ICU cases, you are having communication with the seniors.
You're having postings.
You are having postings, you are having online discussions, you are having clinical scenario discussions about various cases. So,
and I think the consultants from all the departments.
The departments, including gastro, everything, neuro, every departments are, that is also boosting us. And that is giving us an idea that we are doing something great actually. Because at a point I thought, when I understood that PLAB, when you take the PLAB path, you are just again a junior doctor in the UK. But that when made me a regret thought that, I am not upgrading, I've wasted this much time as you have told. So I should move to a higher level. But of course, in medical field, you can't completely rely on time. So I completely trusted the process. Then I believe that everything is, now I started getting this thought that I'm doing something, and soon, if as you are told me, I think that when we joined, I talked with you a lot.
Yeah.
I didn't, and you also know I didn't make a decision within a day. I thought, I think a lot, and then only I came to the decision of MRCEM. But now I feel like I'm doing a PG, and I'm also getting knowledge. It's insane. Like the knowledge I'm getting is, even you can also assure.
Yeah, both are right now on the go. You're not stuck somewhere. You're stuck with NEET. You're stuck with PLAB, and both are right now on the go. And at the same time, the good thing is that NEET pathway is still open for you.
Yes.
Your PLAB pathway is still open for you. Maybe those interviews which rejected you in the past right now might take you in just because you have MRCEM right now.
Addition.
Yeah, so that is adding more value to other competitors who attend for this interview, because you have a lot of options in CSR pathway, even for the locum ships. UK is not far unreachable when you do that kind of a royal college.
And I believe it's not just UK, even in UAE countries.
That's
because even I'm not a person who want to finish my career in UK. I really wish to move to UAE. So when I studied about that part also, even I am able to understand, even Dubai provides you a platform if you are completed your MRCEM, and I think even the pay part and also the
job security,
everything that's all that is definitely giving us a hope.
So for migrating from India to abroad, I think MRCEM is the best pathway for emergency medicine.
Because even if you have an MD or DNB, that doesn't matter.
Yes.
You need to have an MRCEM to continue. But of course, in India, the best thing to have is definitely MD DNB, which is still open for you.
Yes.
But for those who don't want to waste time, like John is not someone a great fan of Indian system, so we do have our own shortcomings which India is right now working on with. But for them, the best choice is of course they don't want to waste time with NEET. They have to they need to do MRCEM even if they do MD or DNB. So both of you are right now on the go, or you're not stuck somewhere. The career is open for you. You started. I mean, MRCEM. I won't say until you join. Even if you join in MRCEM study academy, an academy by StudyMEDIC or something, until you clear the first part, I don't think you don't feel like you are in a postgraduate program. Right now, we can say, right now you have a Royal College degree or Royal College certificate showing that you cleared Part A. So that itself adds value, and of course that has enhanced your career academic excellence that you were having until now. So
and that also StudyMEDIC provided us an express pathway for 6 months, and we both were able to clear
6 months.
Yes, 6 months we were able to clear.
Which I don't think.
So that's such a short span of time. No other academy, like I said, we should take pride in being that academy out there across India, which did this MRCEM program and in the MRCEM Part A in just 6 months. And of course, we don't want you to stay a lot of time here and waste your time here. Maybe 2 years is not enough for you guys to learn emergency medicine, but still, after you do Part A and Part B, after 2 years, you are going to get a chance out there in many other hospitals and many bigger hospitals where you can at least work as a senior resident. And you can excel your extra skills out there, and slowly maybe after 3 years, takes time for getting a slot, but maybe in 3 years you will be coming out as an emergency physician. So 2 years by core training and giving you ambient time for you to study. That's the good catch of Indira Gandhi Cooperative, where endless shifts or hectic shifts are not made. You have enough time for you to prepare Part A and Part B, and Part B of course needs a lot of field knowledge and a lot of things to learn. I hope you have started looking into it. So Part B needs that much time, and we are giving you, until September. I hope in September also we come out with 100% pass rate in the Part B, and our platform is right now completely set for you guys to learn, and we have given ambient time. We have kept a rotation part, schedule, everything in a way that unlike other academy, you get the best time for studying and you get the best knowledge, and within the system, what best we can give, we are giving it to you. So
when it comes to skills, actually Indira Gandhi provides us a great platform to develop skills, because there is no other PGs in any other department. So in ortho, even surgery,
you get dislocation to handle dislocations, because in the middle of the night there is no DNB resident for ortho, and even pediatric cases. And
For all the emergencies, actually, there is like only
Hands-on
chances in us.
for
Because
rest of the
most of the ward cases
yes,
also.
everything
So
we are itself
involved in
managing, yes.
every departments. That is all.
unlike other hospital where they do have on call for every other
Yes,
department,
exactly.
we are actually getting a chance. Actually,
exactly.
that's what you call something which has come because of this hospital not being up to that super specialty level. Being a humble hospital, we are getting that much chance.
And all the consultants in every department are helping us a lot because they consider them as their department PGs. Some point of time I felt like I'm an ortho PG or like an anesthesia PG because the amount of hands-on experience they give us is like not happening any other hospital, I think so.
Yeah, immense support is being
Yes.
provided by all other departments.
And all the clinical discussions, the inputs given by all the consultants from other departments. Even if we present a small case, the amount of inputs given by other department consultants and HODs are like it's like immense amount of effort they are also putting.
We are getting more knowledge. Which
Yes.
some of the things which we never
Even
knew.
we emergency physicians won't be knowing something from other department being taught to us. So a lot of things, I think the platform is helping you guys a lot, and of course as we progress ahead, we'll have more success stories to coming ahead, and part B is coming around September, and we are all set to go for that adventure ride. And as our whole hospital and department have set up your platform to learn and do it. So I hope you guys both inspire rest of this people who are watching this podcast. You are having your fellow juniors stuck in both these pathways, and they need to have an idea how you're going to end it. So as we promised, we need to, within 2 years, we'll be coming out as an SR or an emergency physician in making by Part A and Part B, and see hopefully in next 2-3 months after 2 years, Part C 2 to 6 months. I mean, it will take some time to get slowed, but by then you can expand your experience by SR and you can get into the field as an emergency physician. So that's what we all are hoping you guys to learn from.
Thank you.
So regarding your academy, I think we have sorted our duty hours in a way that you are not exceeding your duty limits, and at the same time you're getting enough time. So I think 15 days, right?
15 days.
15 days you work here, and rest of the 15 days you get off. So I think you have enough time. And how do you think you both have been having the same schedule running out? So how did you plan your studies to, within 6 months you cracked it, so how did you plan that study?
That is the other good part working here at Indira Gandhi. I don't think any other hospital provide you with so much. It's like that they are not forcefully doing it. The system works like that, and I don't think the load is going much more higher on any other colleague because of that shit.
Yes, exactly.
So that is also giving us a
Without
lot of
putting
time.
the other one on pressure,
Yeah.
you're getting a lot of
And you're getting enough relaxation time, and which is very important when it comes to emergency medicine.
Exactly.
Because that is I believe emergency medicine is one of the department where in your entire duty hour you are in stress.
You're on
Anything can
toes.
come.
You're on your toes.
You have to move fast. You have to act fast. Everything acts. So for such a thing, we definitely need relaxation days. And when it comes to exam part, of course, those days we are getting more days. We are able to invest more time on our studies because of the free hours that we are getting. Along with that, we are not losing our touch with our clinical things. So along with I think it's a good thing when we are
well
working
balanced.
Well balanced.
Exactly, like what John said is very correct because only 15 days are only there for us for working. So rest of 15 days we are able to take adequate rest and follow our classes in StudyMEDIC app also. And the StudyMEDIC app is designed in such a way that the mock tests are happening at a regular interval of time, which help us to assess ourselves. And based on the mock test results, I was able to contact our faculties like Srishna sir, Kushal sir, and Nikhil sir, which helped me clear my doubts and change my plan according to my results in mock test. And in regular interval of time, I was contacting Dr. Nadim also, like how to approach the exam, how to manage the time. And just like we got like study leave, like 15 days we got study leave, which really helped us in our exam results. So last 15 days we were not having duties, we were able to sleep properly, we were able to like study according to our timetable. And last 5 days we were having all the like faculties in Indira Gandhi, all our ER physicians, we were discussing the questions, important topics, which actually helped us in our exams. Like I think almost half of the questions we discussed in during our last 10 days in our ER itself, and that is the big part. The adequate rest and adequate clinical exposure is happening in Indira Gandhi. We are able to work and study at the same time with adequate rest, and like guidance is most important.